As the rise in COVID-19 cases continues, there are calls as to whether or not mask mandates should be brought back in the province of Ontario. Joining me now to discuss that and more is cardiologist Dr. Christopher Labos. Dr. Labos, let's start off with that point as to the potentiality of bringing back mask mandates in the province of Ontario. To what extent would that actually have an impact on COVID-19 cases? And is it something that should be mandated again, or is it something that should be more encouraged than mandated?
So I think it would make a difference. Absolutely. I mean, this is a respiratory virus, so if people are wearing masks, we decrease the spread of transmission. I think that's pretty clear. I think we've proven to ourselves how effective masks can be. We had virtually no flu in this country for 2 years because people were wearing masks and being a little bit careful. So if we reinstitute masks, there will be less COVID spread. And we've seen this in hospitals where even before the vaccines, people were not getting that sick because we were practicing rigorous protection with good quality masks. So to the first question of do masks work, the answer is, I think, an unequivocal yes. Now, do you have to bring back the mandate? I think the government should. I think the government should do that. I think it's going to make people safer. I think it's going to reduce the amount of infections and put less strain on the healthcare system. But even if you don't want to do that, even if you don't want to make it a mandatory law and have the police issuing tickets to people, just having a clear message that people should wear masks indoors is going to make a difference, because a lot of people do look to the government and to public health for guidance. So if public health says you don't have to wear a mask indoors, a lot of people interpret that to mean, well, I guess I don't have to wear a mask. And they don't. But if you tell people you should wear a mask, even if you don't enforce it actively, just that clear, unambiguous statement, wear a mask when you're in an indoor setting, that is going to make a difference. And I think more people are going to start wearing masks at that point as well.
What should the definition of fully vaccinated be after the fact that NACI made a recommendation as to fourth doses in the fall? How should that change the definition of what fully vaccinated actually means?
So 2 doses is clearly inadequate when we're talking about the Omicron strain and all of its subvariants. It really should be 3 doses. And then in the fall, if we do actually approve the bivalent vaccine that also has activity against the Omicron variants, then it probably should include the fact that you got an Omicron specific booster as well. That would really define the optimal degree of protection that somebody can get from vaccination.
And then just lastly, we're expecting Canada Day protesters, supposedly freedom protesters, to make their way back to Ottawa, many of them protesting COVID-19 and some of the restrictions that have happened. What's your ultimate message to them, seeing as how when they were there in February, they essentially occupied Ottawa and took Ottawa away from the residents of Ottawa for almost a month on end?
There's an old saying is that your freedom to swing your fists ends where my nose begins. So people can do whatever they want, but the minute your actions start impacting others and start affecting public health and public security, that can't be okay. And so we have to start looking at public health and vaccination and COVID control measures as something that relates not just to the individual, but to the society and population as a whole.
Okay, that is cardiologist Dr. Christopher Labos. Dr. Labos, thanks so much for your time and for explaining some of the latest COVID-19 numbers and the potentiality of bringing mask mandates back here in the province of Ontario. Thanks so much.
My pleasure. You take care.
You too.